here at home, we are hearing from the mother of Dante Melton Jr. now, one day after the Attorney General's office announced the officers involved in a shooting death last year would not face any charges. As we've reported, Melton approached a Baltimore City officer last June asking for help at the time. Body camera video shows he was handcuffed and that a call for an ambulance went unanswered for hours. Police confirm Melton was having a mental health crisis. Following the AG's report yesterday, Melton's mother says investigators blamed her son for what happened.
The entire report was absurd. It blamed my son for having a mental health crisis. The report was victim blaming. My son was a human being, He deserved to live. He deserved to be the father that he could be. He deserved to be the son and the brother and the cousin, and we all loved him. Do not get lost in all of this rhetoric that's going around.
Now, Melton's family has described his death as a systemic failure. Now, city leaders looking at alternatives to help people in crises just like this. Tara Lynch, live on your corner in Baltimore City tonight. And Tara, the city already has a crisis response team. We know that. But the council called into question that team's timeliness and effectiveness. A lot of questions surrounding that.
Yeah, Rick, this team has come under fire really since Dante Melton's death, and another situation that happened just 24 hours later in June of last year. Right now, the Baltimore City Council calling a lot of questions on this team. This team already deploys for a lot of different mental health calls, but the City Council says that team needs to respond faster and be more effective. The council also considering adding a civilian response team to deal with nonviolent, non-criminal calls.
Why is it not working?
Fixing Baltimore City's crisis response was at the forefront for the City Council Thursday night. Behavioral and mental health crisis calls came under fire last summer after 2 people died after interacting with police during a crisis. Dante Melton Jr. died in police custody back on June 24th after approaching an officer to ask for help. An ambulance never showed up because the city's dispatch system was down. Melton began to experience a physical crisis, resulting in his death.
Dante has gone to an officer before who helped him get to the hospital. That didn't happen this time. The complete incident was a failure.
Less than 24 hours later, Patasha Clark Brooks was shot and killed after police responded to her home in West Baltimore while she was having a mental health crisis. Police say she lunged at officers with a knife before she was shot.
She wasn't just what you hear, it's been 20-some calls for mental issues. She wasn't just a mental person, she was a human.
Experts from across the country weighed in on what works for mental health response in their cities, including the chief of the Durham, North Carolina Police Department. The City Council asked questions about how to improve response times and what units are dispatched to a scene.
We've had 39,325 responses. We are averaging 6.05 minutes to scene.
Wow. When I call 911, when I call 988, that there is someone, a clinician, a peer, someone who can meet the need that I am having that can respond quickly.
City leaders are now suggesting adding a civilian response team to handle nonviolent, non-criminal calls.
We're talking certainly about mobile crisis and what is needed when someone is experiencing a mental health crisis, a clinician on site immediately. And we're talking about this alternative response that addresses quality of life concerns.
The Baltimore City Council did ask how much would it cost to make Baltimore's system more effective and state-of-the-art. The mayor's office says that those numbers will be on the council's desk by the end of the month. Meanwhile, the Baltimore City Behavioral Health Collaborative is also meeting at the end of this month to discuss this more. For now, reporting live on your corner in Baltimore City, Tara Lynch, WJZ.
A lot of moving parts with this, Tara. Thank you.